Morning. Good morning. We're gonna get started. I'm Daniel Eisenberg, and I'm a faculty member in the School of Public Health Institute for Social Research. Welcome to the second day of the Depression on College Campuses Conference. I'm very pleased to be able to moderate this next session, which is titled Redefining the Culture of Stress, a Leadership Perspective. We're fortunate to have three top-level administrators from different universities in student affairs here for this panel. And they're going to talk about institution-level programs and policies that they've implemented in recent years to try to address the culture of stress. And I think you'll see in their presentations, and then they'll present each for about 10 minutes, and then we'll have plenty of time for questions and answers. I think you'll see throughout that they're not necessarily trying to eliminate stress entirely. I think we all understand that stress is an unavoidable and often productive aspect of college life. But what they have done is some innovative things to try to mitigate the negative impacts of stress for their students. So we have Gina Casalegno, who is Dean of Student Affairs and Associate Vice President of Carnegie Mellon University. She'll go first. She'll be followed by Susan Murphy, Vice President of Student Academic Services at Cornell University, and then Javaune Adams-Gaston, Vice President of Student Life at The Ohio State University. First up, Gina, thanks so much.
Thank you so much, Daniel. Good morning, everybody. How are we? Good. So I'm so pleased to have the opportunity to be here with all of you, to be a part of this really important discussion. As Michael Young shared with us yesterday, we as university leaders are facing tremendous pressure to be doing more and more with an increasingly complex set of needs among our student bodies. In the context, really not just in our own university cultures, but in the broader context of a rapidly changing set of societal norms and expectations. Many thanks to the University of Michigan for being a leader in gathering us together on the theme of this conference, Managing the Culture of Stress. So I have to admit, a little bit of irony in this. I was sitting in the session yesterday on Ban the Busy and bringing a mindful approach to our work and students to their work on our college campuses. And much like the terrific presenters self-reflected yesterday, I come to you all feeling like I have more questions than answer on the idea of managing the culture of stress. So we do look forward to spending some time in discussion with you. Maybe a difficult forum for that, but we do have opportunity for people to come up to microphones and start what we really do hope will be a conversation among people who are committed to these issues and people who can help us build the compendium of best practices. We three bring a lens and a perspective to share with you, but we certainly don't have all the answers. At least I hope you didn't come looking for them, because we're looking to you as well. So our plan this morning is to spend some time briefly to share aspects of our work on each of our campuses to frame that conversation with all of you. We look forward to that interactive dialogue and hope to have at least half, if not more, of the presentation and discussion with you. So my plan is to walk you through a framework that we deployed at Carnegie Mellon University in the last several years to engage the whole of the campus, various campus stakeholders, in these discussions to really look at how we could affect change on this issue. You'll see that my top slide says not managing the culture of stress. When our conversations started, which I will share with all of you what brought us to that campus conversation, the students named it stress culture. And we have a strong program in rhetoric in English, and I quickly worked with my colleagues to say we've got to come up with another way to talk about this. So let's talk about this movement on our campus as a move to enhance campus culture. So stress is not a bad thing in all forms, but this idea of the culture of stress was something we wanted to move beyond. So I'm going to talk about that framework of how we engaged our campus constituents, leaders, and stakeholders to move that conversation forward. And from there, Susan Murphy from Cornell will talk about the many terrific initiatives that they've developed over the years that focus on a holistic mental health framework to guide their efforts. And from there, Dr. J, Javaune Adams-Gaston, will offer some insights about the work that she and her colleagues are doing at The Ohio State University. One of the things I'm really excited to hear about from Dr. J is some of the unique aspects of the stress that exists in young people's lives that we all are called to contemplate in our education of the whole student. Okay, so here at Carnegie Mellon, in December of 2012, right on the eve of final exams commencing, we lost a student to suicide. Within days of losing Henry, a beloved member of our campus community, a student who'd spent about 3.5 years at Carnegie Mellon, she was a graduating senior a semester early, had an editorial published in the student newspaper called The Happy Mask. And I have to say that last week when I was reading the Chronicle's article on the pen face, I don't know how many people saw that. If you saw it, yes. It's hard to see you all, but if you haven't seen it, it's a really good piece. I would encourage you to take a look at it, about the University of Pennsylvania and the discussions on their campus about the pen face. Was eerily reminiscent. I felt like it was a moment of deja vu of the conversations that we had on our campus when Katie Chironis's article or editorial, The Happy Mask, was published. So in that editorial, Katie reflected on her experience at Carnegie Mellon as experiences where she and her peers put on the happy mask, everything was perfect, deflected authentic engagement about how she and her peers really were doing, where university resources weren't adequate to help students take the mask off and seek help, where students were very afraid to admit failure, where they didn't dig deeply beyond the surface with those they cared about to even know when they were in need of help, where faculty lacked compassion in the face of students expressing stress, hardship, or crisis. It was a pretty dark time for our campus to see this editorial and the wave of social media that ensued. I should note, it's important to me whenever I talk about this precipitating loss in our community to share that the family and friends who knew Henry best didn't believe the premise of Katie's editorial that the reason Henry lost his life to suicide was because of our stress culture. In fact, the opposite was what his friends and family believed was true. But nevertheless, there was a campus conversation that had been launched in Katie getting all of us to take a look at the concepts that she outlined in this editorial, The Happy Mask. So I gathered together with a number of my colleagues, most importantly our Vice Provost for Education and our student body Vice President, who had been committed to these issues throughout her tenure in student government, to take a look at what we could do to harness the conversation that was happening on our campus and use it as an opportunity to examine our culture and seek change from the ground up. So we hosted a town hall just after classes resumed in January, and gathered together with over 250 participants. I don't know what happens on your campuses. I'm a campus of 12,000 students. Typically when we have a town hall on an important issue, if we get 40 people, we're really pleased. So to have over 250 people come together in a room, from the university's president to academic deans to many students, alumni, and staff, it was really powerful to us, and we were affirmed that this was something that our campus, and I don't know if I mentioned faculty, but they were there as well, that people cared about this issue. So Amy, Mila, and I co-facilitated a discussion, as much as a discussion can be with 250 people in the room. We offered some framing remarks and then had 2 microphones, just like we do here in this room, and offered an opportunity for people to come forward, share their experiences, their reflections on what we as a campus could do to move the needle in this domain. Themes of the conversation really focused on issues of stress, wellness, and success, and they were really explored by the 25 or so people who were able to get to the microphones, who shared their experiences from deeply personal vantage points. Discussions on fear of failure, fear of stigma for reaching out for help. Reflections about how the virtual race to the top continued, just like our admissions process has, unfortunately for our students coming into college, I think have really encouraged people to get in a mindset of having to have done it all. So we hear our students talking about the community service that they did, the ways that they are right brain, left brain thinkers, the patents that they hold, the companies that they've already started at the age of 17 when they're applying to college. Well, that mindset continues every day on our college campuses once here. We heard from people that there was concern that university resources weren't enough, advertised or resourced well enough to meet the demands of our students. There were some bright spots in the conversation. Students talking about their peers and their faculty and staff from the university being tremendous supports to them when they reached out for help. Students even mindfully contemplating what mattered to them, what their values are, what their goals were, and the conscious decisions and choices they made about their involvement in and out of their academics to align their priorities accordingly. It was a great conversation that really was just a start for us, and because it ultimately only allowed for about 25 or so people to come up and share their perspectives, we knew we needed to do more to try to get a greater representative sample from our faculty, our staff, and our alumni, and importantly, students, to hear about their experiences at Carnegie Mellon. So we looked to, I'll catch up with myself on my slides here. So we looked to a model that we had deployed on our campus called, borrowing from the deliberative democracy movement as an emerging political theory that has a framework that gathers a diverse group of people together on a specific issue. They're guided in small group discussions by trained facilitators through a deliberative dialogue followed by discussion with an expert panel. The deliberative loop, which borrows from the deliberative democracy, can be a tool that facilitates participants' deeper understanding of an issue and produce information that aids decision making and policy. So we moved into this deliberative loop. We had over 100 attendees, and we sculpted this based on those interested. So it wasn't exactly a representative sample. So in that regard, it wasn't a true deliberative loop, but we, again, were borrowing from the model. So we had undergraduates represented at about 50%, graduate students, faculty, staff, and alumni. So I've talked a little bit about the format already, but we deployed pre-deliberative loop surveys, employed post-surveys. We were able to look at people's movement in their perspectives about what were the most important things the university could invest in moving the needle forward in this enhancing campus culture conversation. We focused on these 3 areas that had emerged from the town hall on how do we define success. We looked at policies in the academic environment and on personal wellness. So what was so interesting about the deliberative loop is people had an opportunity to rate their thoughts on 20 different areas we could focus our attention as a university. Which were most important and where did they believe we would get the most impact if the university focused their efforts, our efforts, in these domains. What was really interesting to look at in the analysis from the pre to the post survey, so the post survey happens following deliberative dialogue at small group tables that have members of each of those representative bodies at the table, facilitated, and then they have access to an expert panel to pose questions, and then they come back and have further discussion, and then they take the post-survey test. There was really movement from an externalization of this is what the university needs to do to change the campus culture of stress. And there was movement to some of those things are still important, but there was a greater acknowledgement among all participants that students on our campus needed to be comfortable with being an active participant in this process of shifting culture and in managing their own stress and in fighting the effects of the culture of stress. So there were 5 areas that we were suggested to pursue through the deliberative loop format. We took these out to various governing councils, student government, to the Associate Dean's Council, and shopped these ideas around and decided to set our efforts in these areas in the coming couple of years. It has been an evolving conversation. I don't want to say that this snapshot in time is the whole of what we have done, but the areas that were suggested were a greater oversight of alignment of course units to actual workload. So we have some courses that are known to be 24 hours of work in a given week in the School of Computer Science, yet students are only earning 12 units for that course. So that's a sort of half of the right ratio from what students report is their experience and how much time they spend. Equipping students with the tools to be greater self-advocates of their personal well-being. That was something that didn't score in the pre-survey, but then did score in the post-survey after deliberative guided discussion. Services at all times of day to talk with a trained counselor about stress that are point of need and not just crisis-driven. Peer mentoring programs, and a seminar for the first-year undergraduate transition, which was not something that we had deployed across the university. We also deployed a request for proposals. So we asked the campus, we're going to put together some funds and ask you, what could we do to move the needle in this space? So this was a partnership with student government and the Vice Provost for Education and Student Affairs. We received 9 proposals, ultimately funded 4. So we took a lounge in a residential area and converted it from your everyday TV lounge and study lounge to a mindfulness room. And that was very much driven by a motivated student who said, we need a space where we can unplug, where we can meditate anytime that we want, where we can just go de-stress. We launched mental health first aid training. We gave some funding to a Random Acts of Kindness student organization. It was a really easy win with very little money. They go out and really spread cheer and positive morale. And then we did pilot a first-year transition course called Thrive at CMU. So here's some pictures of the mindfulness room. And then we looked at everything from policy related to our course alignment to units that I already talked about. We looked at augmented staffing models. I'm not going to go through each of these to make sure I leave time for our discussion and for each of our panelists, but these will be in the notes that you have access to. We augmented our staffing in counseling and psychological services, in student life, and we took a look at our academic course policies. And as I said, this really is a continuing campus conversation that has been really important to us at Carnegie Mellon. So some reflections on this process. There really was such great power in, from the beginning of this campus conversation launching in social media, to look to my colleagues in academic affairs, key faculty who are leaders on our campus and well regarded by their peers and by our students, and most importantly by student leaders, to really take a look at these issues. It was important to us that we maintain the rigor that is the experience at Carnegie Mellon. Nobody wanted this conversation to be a zero-sum game, that by focusing on wellness, that we would somehow, quote, dumb down the curriculum. That was never in the discussion, but being able to name that and be very clear that we didn't see it as a zero-sum proposition. We talked a little bit about this yesterday with Michael's presentation that helped us see this issue as not just on our individual campuses or our collective campuses, but it is part of a broader societal set of norms that we are facing that make these issues really difficult. The culture of busy was talked about a lot yesterday in one of the sessions. So we have to recognize that context that we're in. And as we prepare tomorrow's leaders, we really do have an obligation, and that's why we're all sitting in this room, to help students build resilience, pivot from failure, build a greater capacity for reflection, and a mindset for work-life integration. Yesterday's presentation was great because I have long talked about work-life balance is just something I know I can't achieve. I don't really know how to teach it. I can't model it. But this idea of work-life integration, yesterday's Ban the Busy talked about, I think, life, work, fit integration, and I loved that concept. So I think we have some themes to build upon. I look forward to our discussion and conversations.
All right, thank you so much, Dean Casalegno. And sorry about the blurriness of the slides earlier. We were trying to show visually how everything was becoming clear as Dean Casalegno presented. Our next speaker is Vice President Susan Murphy from Cornell University. Let's please welcome Vice President Murphy.
Thank you very much, Daniel, and thank you, Gina, for a very thoughtful presentation. And I will just have to say your last comment about work-life balance or work-life fit, I actually have a cousin who's in that business, and every time I used to talk about work-life balance, she would tell me that it was the wrong conversation, send me away, and her name is, I'll proudly tell you, Callie Yost, and her work is Work Plus Life, Find the Fit That Works for You, and it's been very educational. I'm pleased to join my panelists to talk with you a little bit about what Cornell University has done to redefine the culture of stress. Similar to Gina, this is not a word that goes away, and in fact, we don't believe that it should, but it is something that we need to put in a different perspective. One of my colleagues came across this quote from Alexander the Great, which has become a favorite of mine. And I think it's clear, but just in case, when health is absent, wisdom cannot reveal itself, art cannot become manifest, strength cannot fight, wealth becomes useless, and intelligence cannot be applied. And if this was an issue back in the days of Alexander the Great, maybe we've made progress, but maybe some of this is just ever thus in the human condition. We find these issues very pertinent at Cornell University when we do our undergraduate surveys, which we do for the whole student body on a biennial basis, and then we do seniors only on the alternating years. In the last time that we completed our Pulse survey, 38% of our undergraduates told us they were unable to function academically for at least 1 week. And when we define function academically, we say they either missed classes, they were unable to study or complete homework, and they attributed that to perhaps diagnosed depression or anxiety, or how they label it in their own life, and stress. And these data are not unique to Cornell. They track national data, but it's a compelling number. And whenever I talk to faculty and I say 40% of the students in your class are having trouble functioning throughout the entire semester, there's something here we need to focus on. In some ways, this statement probably should come in after the next one, but we were thrilled when our faculty authored the strategic plan that has been guiding our work at the university from 2010 to 2015 to find this statement under the section that was called the objective around achieving educational excellence. The faculty wrote, it was a commitment to promote the health and well-being of students, and they were explicit about all students, as a foundation for academic and life success. One might wonder, why do we have to define students? We have found at Cornell, because we are 14,000 undergraduates and about 6,000 graduate and professional students, that our graduate and professional students don't see themselves when we just say students. They think we're talking about undergraduates. So we've tried to become much more intentional when we mean students, as in all students, to spell that out. But I don't know about your faculty, but for the faculty at Cornell, to have them put in writing, I went to the trustees and all of their peers, that health and well-being were a foundation not just for academic success, but for life success, we found to be very encouraging. They, in their section on the strategic plan, which you can actually find on our website, they acknowledge the rigorous and demanding educational environment that was, again, at the heart of the university. But what they wanted to address was the recognition that those who were experiencing excessive pressure would not succeed. And that indeed it's our obligation to have our students learn the life skill of being healthy and balanced. I will tell you that this statement came out at the end of the year of 09-10. You can see it's May 10. In that year, Cornell University lost 12 students, 6 of whom were from suicide, 3 in the space of a month. So it was a little hard to miss the fact that we had had a suicide culture that had occurred, a cluster, I should say, a suicide cluster, and the faculty needed to partner. But nonetheless, they put it in as a forward direction. We are strong believers in stealing good ideas when we can find them and promulgating them. The JED Foundation, a number of years ago, developed a suicide prevention model that might look a little bit like this, and there's a wheel. And we initially started with suicide. We've adapted it now for mental health, and we've even actually broadened it a little bit for a campus health framework. So depending upon my audience, I'll steal the wheel. We've adapted it also now for sexual violence prevention. But in essence, what this is trying to capture is that in addressing, in this case, a healthy mental health framework, we need to think about the individual, the interpersonal, the institutional or community, as well as societal, as Gina just talked about. Michael Young yesterday talked about a tiered approach. We just happen to like wheels at the university. I will just name these briefly, and then I'm going to focus just on three, because this is about what are we doing at the leadership level and the campus level. We start at noon, so I'm going to be talking in a bit more depth about fostering a healthy educational environment. Also looking at what we do to promote social connectedness and resilience, and increasing help-seeking behavior. Those are the three I'll focus on in a minute. But it's also critical that we identify people in need of care. Again, in the idea of stealing ideas shamelessly. Michael Young's work at University of California, Santa Barbara, about recognizing students in distress, we took liberally and created both two books, recognizing and responding to students in stress, one targeted to faculty, one targeted to staff, and also have developed interventions with an interactive theater ensemble that we have created videos, again, one targeted for faculty and one for staff. Very similar, but the language is different depending upon your audience, and so we spent the time doing that. And we are spending a tremendous amount of time teaching our students how to recognize their friends who are in need of care. We provide medical and mental health services, obviously. At Cornell, they are integrated. They all are part of health services. We're about, if I get approval next week, to expand and renovate our health services center. And all of our floors in this new expanded facility will be what's called integrated care modules. So our therapists and our clinicians are going to be in the same area. There will be a shared waiting room. You go into one door. So as a way of destigmatizing, oh, you must be going to counseling and psych services. And we are actually now embedding a behavioral health consultant on our medical teams as part of this integration. We all are, if we're residentially based campuses, have to deliver coordinated crisis management. In that year of 9-10, we exhausted ourselves, as you can imagine. And then we became very focused on restricting access to means of suicide. New York happens to be a state that prohibits guns on campus. That's one method of prohibiting access to suicide. We all lock up our chemicals if we have science areas. We're blessed with a campus that is cut by two gorges thanks to the Ice Age, and Cornell carries a reputation, I think, undeservedly by our numbers, but understandably, when students were committing suicides in the gorge, because they're jumping off a bridge that 3,000 students walk across twice a day. So there's a huge visual reminder. Those last three suicides in 9-10 were off the bridges. That was the suicide culture. Ithaca has had a conversation for over 40 years about should you have some kind of means restriction. We now have nets under all 7 bridges, half of which the city owns, half of which we own. We ended up paying for all of that, but we felt it was so critical to address that issue. And we have had only one suicide from the bridges since 2010. So a dramatic difference. So those are the other pieces of the puzzle. But let me talk about what are we doing to address this stress continuum. This is just a reminder. It is a continuum. Some of it is very healthy. It's what gets us up out of bed in the morning, that we have a little stress. We have things we have to do. There's a point at which actually stress, right before you come give a speech, right before you compete in an athletic event, you have enough stress going, your adrenaline's pumping a little bit, that hopefully you're going to hit the peak performance, and that you haven't gone over the hump where you have a bit of imbalance or you get into the breakdown. So this is just a reminder, and we have a section on our website that talks about the stress continuum, that not all stress is bad, but dysfunctional stress is what we're trying to address. So in fostering a healthy educational environment, this is probably where I might have put that statement from our faculty, to have your faculty leadership talk about the importance of health and well-being as the foundation for academic and life success, sends a huge message to the campus and begins a conversation in much the same way Gina described a conversation that was prompted by the students. We find that we're talking about our academic calendar. Cornell is in Ithaca, New York. Ithaca can be pretty cold and pretty gray. We run in the spring semester a long stretch from mid-January till mid-March without a break. We instituted a fall break many years ago to deal with that long August to Thanksgiving. We have a fall break now around the middle of October. We are now in a new calendar that's putting in a 4-day break in mid-February. Many students don't go anywhere, but just to not have something due every day of the week, we're seeing whether this is helping at all. Our faculty senate actually put in their own legislation that they should not be giving assignments the day before a holiday to be due the day after. Now, the students will be the first to tell you what it's done is not eliminate the amount of work, because the faculty have gotten smarter and they put it in their syllabus. But my response to the students is, if you find out in the beginning of January that you're going to have something due the week after vacation and you didn't start working on it till the time you had 4 days off, you know, some of that's about learning life skills. How do we plan? But the faculty have taken it seriously about not assigning the day before vacation, oh, you're going to have a paper due on Monday when you come back, or the like. When we think about fostering a healthy educational environment, I have the good fortune of overseeing dining. We're spending a lot of time about what are we serving? What about healthy foods? How can we get our students to eat in a healthy way so that contributes to their overall nutrition? The same thing with our fitness centers. And we have taught our fitness center monitors, who are students, to keep an eye on students who are there too much, because some of that gets into an unhealthy link as well. So this whole area of dining, fitness, faculty, student affairs, what about our environment? The nets underneath the bridges for us, which was over here on restricting access to means of suicide, but it's really fostering a safe environment overall, being mindful that you shouldn't go swimming in our gorges as well. There was a very interesting report that I hope many of you have had a chance to see about that the Gallup Foundation put out this last year together with Purdue about keys to an engaged life and career. And they did surveys about who are engaged employees and who are thriving in their life. They identified 6 things that make a difference, things that we can do on the campus that will contribute to our graduates being engaged as workers and having thriving lives. And I want to list those for you because to me it's part of what are we doing to foster a healthy educational environment. The 6 things that make a difference is that you have a professor who cares about you as an individual. That you as the student are excited about learning. You're not just passively sitting in the back of the room, but you're excited about your learning. You have a mentor who encourages your hopes and dreams. Doesn't have to be a faculty member, could be your dining supervisor who's your mentor, but a mentor who encourages your hopes and dreams. That you as a student have been involved in a project that takes longer than a semester, a long-term project. You were active in some form of extracurricular or co-curricular activities, and you had an internship or job that allowed you to apply what you were learning in the classroom. So we've taken these 6 and started some conversation within student and academic services about how can we be much more intentional in these areas and having that contribute to a healthy educational environment. We also have a wonderful set of little handouts that we give our students, connecting with others, choose consciously, learn how to meditate, express gratitude. If you hear one thing I say today, learn how to be intentional about your expression of gratitude. It is a healthy thing to do. Thanks to Randy Pausch from his last lecture, which I have used when I've talked about this as much. It's one of his greatest legacies to all of us. How to eat well, play, exercise. We have these cards all over the campus. There's a little bit of information on the back of each one, again, just to have reminders. A second area that we have been focused on from the leadership perspective is how do we promote social connectedness and resilience. We are social beings as human beings, and so how do we keep our eyes out for students who are not connecting with one another, and how is it we help our students become resilient? If I've seen one thing that's changed in the over 40 years that I've been in education, starting in secondary education and now in higher ed, I believe that we have a cohort of our students, not all students, but we have a cohort of our students who are less resilient than they used to be. Our safety nets have been raised so high for some of our students that they've never learned to fail and pick themselves up. And I don't know about any of you in the audience, but now that I sit here at age 63, there were a lot of bumps in the road in my life that I didn't plan, that I had to figure out how to pick myself up, the most recent of which was breaking my kneecap right before Christmas and learning how to deal with not being independent all of a sudden. If you're not resilient, that can be devastating. But if you have an approach to life that this is just something I have to learn how to deal with and move on, that's critical. We've integrated our diversity initiatives into this whole area of social connectedness and resilience. And as we now talk about diversity on the campus, we start with the composition, because that's, if you will, necessary, but it is not sufficient. How does our campus look in terms of engagement across all groups? How does it feel about being included across all groups by gender, sexual orientation, race, ethnicity? And then, obviously, how does it look across achievement? Our students have been essential in this. Our group of students is called Cornell's Mind Matter, but Active Minds is on so many of our campus. They are just absolutely essential. And we are now partnering with a couple of our academic programs to have a program. I don't like the title because it's called Staying Balanced. I'm not sure our students can be balanced either. But the idea is those things that I just showed you in the cards, how do you incorporate those in your life? And I would say we've been quite intentional about how do we integrate our faculty in the social connectedness with our students outside the classroom. Faculty and residents, every one of our athletic teams has a faculty advisor, student organizations, so that's a very important connection. Lastly, let me just touch upon help-seeking behavior. In the year we lost 12 students, 6 from suicide, our president, David Scorton, who happens to be a doctor, was very clear in his statement in the spring to our student body. He said, if you learn one thing at Cornell University, learn to ask for help. That was the title of a column, any speech he gave. And I was so struck by our students who, they didn't hear anything else we were saying about extended hours, about counseling and other things. What they heard was our president, who was a doctor, saying, if you learn anything, learn to ask for help. And that was repeated back to us again and again. So the importance of leadership messages, and then to have the faculty reiterate that as well has been absolutely critical. In that strategic plan outlined by faculty, making sure that we had appropriate resources in student and academic services to support our students who were asking for help, they saw to be critical. We use our students, the Empathy and Referral Service, as one place we encourage our students to ask for help, because peer-to-peer is sometimes the lowest barrier. We have now distributed our counseling staff. In addition to counseling in the health services as part of these integrated care modules, we have them out across campus. They sit in academic advising offices an afternoon a week. They're in our international student and scholar office. They're up in our athletic offices. We know, and I think in talking to my colleague Alejandro from Stanford last night, we have populations who will not go seek help for mental health. It's either a cultural stigma or a family stigma, but they'll go seek help for their academic performance. And if their academic counselor says, well, you know, I think you should go down the hallway and talk to my colleague Daniel, because I think he actually could help you more than I could, they don't have any compunction. They don't know Daniel's a psychiatrist. They just know someone's in arts and sciences advising who might be able to help them more than I might. We produced 2 videos for our students, one for graduate students and one for undergraduates. The undergraduates called Real Students, Real Stories, graduate students, Graduate Stories. In there, and again, our president was wonderful in this, he modeled about asking for help when he's on a screen this big, and he said, did you know that your college president flunked a class when he was an undergraduate? He said, that's right, I failed the course. And I went on to become a doctor, and now I'm a university president who's on his way to run the Smithsonian as of July 1. It's a very, very powerful message for our students. So that modeling of we're not perfect and seeking help is something that is absolutely critical. You know, we as the adults to whom they look up need to model that behavior to the extent that we can. So I leave you with just this model of a mental health framework and what, through the fostering the educational environment, promoting social connectedness and resilience, and the increasing the help-seeking behavior, we're trying to make a change at the top, the leadership level of the university, in addressing the dysfunctional aspects of stress. Thank you.
Thank you so much, Vice President Murphy. Our third and final speaker, and start thinking about questions, because we'll have about 20 to 30 minutes afterwards for questions for our panelists. Our third and final speaker is Vice President Dr. Javaune Adams-Gaston from our friendly rivals, Ohio State.
Susan just said how nice of you to invite us. We appreciate it. Well, thank you for having us here today. And I think one of the things that's important is to acknowledge how important it is for colleagues to get together, to talk about these issues, to talk about best practices, to see the ways in which we are doing things similarly, but to learn from one another other opportunities that might exist. As Daniel said, I'm at The Ohio State University, and we are a large institution. We have 65,000 students, 56,000 reside on the Columbus campus. We have about 45,000 undergraduates and 11,000 graduate and professional students, and all of them reside on the Columbus campus, and it's one large integrated campus. And then we have our regional partner campuses, and we have about 9,000 students who reside on those campuses. And when I say reside, everybody doesn't live there. They just come there, and some live, and some just come there. So we're a large, comprehensive institution, and student life really has the responsibility for much of what we call the outside of the classroom or the co-curricular experience. So we're everything from dining and housing to disability support services and recreational sports to activities and the union, and then we start thinking about things like student health services, counseling and consultation service, student wellness, and we have 30 units that are student focus units. We have 40 units altogether. So it's a large machine, and a large machine like that only works if you have an incredible team. And so one of the things that I say to people when we receive the JED Foundation recognition, the campus seal from the JED Foundation, or when we receive the top 15 best places to work in student affairs, it is about our team and the people who work at the university in student life day in and day out, who really are making the difference because they're committed to the change that needs to occur, to look at our students in their present generational form and not think about how we used to be, but to really think about who are these students who are coming through our doors. And I think Susan is absolutely right. They look different. They have different needs, and they have different ways of seeing the world. And so I am really pleased that I get to be engaged with my colleagues both on campus and across the nation, because I know how important this work is to our universities and to people who are working across universities to make it better for our students. So you will recall, and all of us are aware, that over the last decade, there's been a real paradigm shift in higher education. Historically, faculty sort of stood and lectured. They gave the information, and it was the student's responsibility to either get it or not. And from a student affairs perspective, there were many, especially those outside, who thought essentially we were responsible for the health and safety of students, but not the wellness, and not the student development, and not the education that happens outside of the classroom. But over time, as we have become more outcomes-based in our thinking and our assessment, and with the continued understanding that there is a student development theory that we're working for, it really has turned everything on its head. So today we really ask ourselves the question, how do we know that we are actually doing a good job? How can we quantify and qualify that what we're doing and what we're giving to students is what they need and what we promised? So at The Ohio State University, we have the Student for the Study of Student Life, Center for the Study of Student Life, and there we have researchers who are full-time researchers, and their whole job is assessment and research. We have 5 full-time professionals. Typically, we have between 4 and 5 Ph.D. researchers and a team of graduate students and others who are doing the work that really has to do with how do we know we're making a difference? Because we can't just keep saying anecdotally, we think this is working. So we're looking at everything from retention and graduation rates to finding a job and to being accepted in graduate or professional school or being prepared for the global society. In all of this, one of the things that I've said as a tenet of student life at Ohio State is our foundation is student wellness. And I'm going to talk in a few minutes about the fact that having that as a foundation means that everything that we're doing, we're really covering, looking at how we help students grow, develop, manage their wellness or develop their wellness, and are ready to be global citizens who are healthy as far as they can be, each one having a very different experience. Excuse me. So when you look at what universities have to do, we have to create cultures, and we have to be unafraid to, as we think about this wellness, to think about mental health as critical to that wellness, that we're not afraid to take that on. And so recognizing, referring, and assisting becomes very important in the university community. We know that mental health remains a large concern for a great deal of the population of U.S. citizens in general. So we know that SAMHSA has told us that approximately 43.7 million adults 18 years or older have had a mental, behavioral, or emotional disorder. And we know that of that 43.7 million people who have been impacted by mental illness, almost 20%, 19.6, are between the ages of 18 and 25. So when you think about that and you spread that over students who are university bound, you know that our numbers are increasing in terms of mental health as our students are coming to the university, which is really very different than what we may have seen 20 years ago. My training is as a psychologist, and I started as a staff psychologist in a counseling center. Actually, I was at both Iowa State and the University of Maryland, College Park. And what I have seen, and I was in practice for almost 25 years, what I have seen is that there is a shift. There are more students who come in already having been treated and or having acknowledged a mental health issue. So we know that according to the AUCCD, which is the Association for University and College Counseling Center Directors, the most common concerns for students coming into the counseling center, depression is about 39.3%, relationship issues about 35.8%, and anxiety 41.6% of students nationally. So think about that. We have these highly talented students who are also highly anxious. Anxiety, of course, is an issue for many reasons. I always say it's tough being a young person in this time in our world. Think of the information that comes to you on a constant basis, and they are interfacing with that information all the time, from Facebook to Twitter to what I call the meanest thing I've ever heard of, Yik Yak. They are interfacing and getting information right here all the time. I say jokingly, as I get older, many of you may not know who Walter Cronkite is, but if you do, you will remember that if there was a tsunami that happened somewhere else in the world, you heard about it, but you didn't see it for several days because they had to go over and get the film, bring it back, show it, okay, and they didn't show it a million times. Now if a tsunami happens, within seconds, it is broadcast around the world over and over and over. There's an in-your-face kind of experience that these students are having that has never occurred before. The second thing that I would say is these students are what I call the recipients of their parents, that would be me and others of us, merit badge sort of experience. So what our students have are lots of merit badges, okay, that are in what I call a mile wide and sometimes an inch deep. So they have been taught that they have to collect all of these things that tell them that they are okay and that they are accepted and that they will move forward in the world. But the reflection and the deeper meaning of what their life experiences are far too often go untapped. If you go on Facebook, and I don't, so let me be clear. So, people will show me things on Facebook, but what I've come to understand is Facebook is the happy place for most people. And when you talk about that happy face that people have to put on, imagine when you're looking at Facebook and everybody's telling you all the great things that are happening in their life, how wonderful their life is. They're taking pictures. I'm at lunches and dinners with students, and they're taking pictures of their food, and they're posting it on their Facebook page. And I keep thinking, the concept of depth and reflection and meaning have to get back to the front of what we do. They also are students who have come from higher and higher expectations, both the internal expectations they put on themselves and the external expectations they put on themselves. Interesting, because I had a panic call from my sister yesterday, and her 12-year-old daughter had come home devastated because she got a 91 on her science test. Her mother and I are rejoicing, and we're trying to figure out what's going on that a 91 is not enough. What are the issues that are happening? And she will soon be joining us at a university. And the internal and external messages that have come to her have suggested, I need to be better. We also know that many of our millennial students, when they come to the university, have had higher rates of acceptance of mental health resources. So this is a good thing. We want to promote that. We know that we're finding, from a vice president's perspective, there are many things that I could talk about that have to do with students and their mental health issues. But I want to talk about two: resiliency and drug and alcohol abuse, for just a minute, and then I know we are close on time, so you'll let me know. I think, and I would agree with Susan on this, one of the most difficult things our students have is managing resiliency. And we're coming to see those students who come to our university as having very high expectations of themselves, from themselves and from their parents, but not having the life tools to manage disappointment and challenges. I can remember when I was raising my children. I have 3 children. The youngest is at Ohio State, and she will graduate. Yes, please. So, sometime this year. And I've said to her, I'm good with this because she's doing fine and just keep moving. But you will find that if you reflect on some of these young people's experiences, when they grew up, everybody got a trophy for just being there. And I think we intended to do the right thing, but I'm not sure it turned out that way. There is no sense that they're winners, and sometimes you lose. And that's not a terrible thing. And that you get back up the next day and you try, but it doesn't mean that you're a loser. So I think our intention was to keep the loser component away, but what we actually did was move to a place where students really are only thinking that they should get a trophy, a merit badge, or some other thing that says to them, I am worthy. Last year's NCHA told us that nationally, 23% of our students report having traumatic or difficult experiences with family problems. 30% of our students reported difficult experiences with intimate relationships. And 34% of our students reported having traumatic or difficult experiences with finances. Nationally, 34%, 1 in 3. So an approach that we've taken at The Ohio State University to combat this is a program we call the Scarlet and Gray program, and that is the Scarlet and Gray Financial Wellness Program. I'm trying to get my clicker. In the Scarlet and Gray program, Financial Wellness Coaching Program, it partners students with peer educators who discuss and plan their financial strategies. Last year we served 1,500. This year we're slated to serve over just about 2,200 students. And what that does is there's an online component and then there's a peer component. And the peers are trained over a period of time. And what they're doing is helping the students think through decision-making about their finances and what they want to do the same or differently in order to be successful and to take some of that pressure off. I say to students all the time, I am less concerned about whether somebody has fallen down, something has happened that hasn't gone well, and much more concerned about their ability to get up. It really is about the resiliency and trying to figure out, what do I do when things don't go well? What happens for students when they lack this sense of resiliency is that it's difficult to persist in face of diversity. So we like to talk about this as a shared issue that is collaborative and needs university-wide attention and support. So we offer multiple mental health service, multiple modes of mental health services and wellness services. And we have expanded and increased those services over the last several years. But if you were thinking that simply increasing the number of therapists in the counseling center, and we currently have 44 therapists, 25 professionals, 16 trainees, and 3 contract, and it's not enough. In fact, it would never be enough. So we need to think more broadly about what we can do. The second piece is drug and alcohol abuse. And I'm not going to talk a lot about this, but one of the things that we have done, we know that the illicit drug use rate was 22.3 among full-time college students 18 to 22. College students are more likely than their peers to report current, binge, and heavy drinking. Among full-time college students, just about 60% were current drinkers, 40% binge drinkers, 12% heavy drinkers. That is self-reported according to the National Survey on Drug Use and Health. So what we did at the university, and we have some really terrific staff who have put this together, is we created a collegiate recovery community. And last year, that collegiate recovery community was able to have about 100 students in its first round who are engaged in the recovery community. We estimate that about 950, if we just look at national averages, of our students are in some kind of recovery from alcohol and other drugs. So we offer a couple of things. The collegiate recovery community has a community resource, but this year, we created a housing opportunity for students who are in recovery. And our Penn Place housing allows those students to live together, to be supportive, and to be drug and alcohol free. Obviously, that's a step, and it's a good step, but there's so much more that can be done. We need to look at what's happening around binge drinking, more addiction, more understanding among our students about what is happening versus what they believe is happening. Perception and reality don't go together well for our students. So what can our institutions do? We have to address the mental health issue head on. We have to be unafraid of it. And though I am sure not every tragedy can be averted, what I do know is that we can find new ways to be both high touch and high tech and support our students. I'm going to skip a couple of things and just go to things that we have done on the campus. We have a YouTube channel that offers videos that inspire and educate on mental health issues. Our counseling and consultation services has done a really good job with this. We have a Pinterest page, which is a collection of inspirational resources, quotes, songs, videos. We have an OSU CS, so it's OSU Counseling Consultation Services app that allows students to make an appointment and provides tips for dealing with a number of factors like stress, illness, and depression. We also do outreach to our faculty. We have an emergency response folder and electronic information that helps faculty members very easily and quickly identify who to call, when to call, and what to do. When I talk about perception not meeting reality, in a recent OSU study, students reported their perception that 50% of other students misuse pain medication. Students' actual self-reported usage rate, 10%. So some of it is about educating. You know, if I believe everybody is binge drinking all the time, if I believe everybody is using drugs all the time, if I believe this is how people are coping, what does it do when I am stressed and have to make choices? Or when I'm in an environment where people are drinking and I think, well, everybody's doing it, I have to be engaged. Perception by students from our autumn 2013 survey said that over half of our students, 60%, believe that their peers use alcohol or have used alcohol in the last 30 days. I'm sorry, 70%. In fact, only 60% had. A third of our students believe that their peers had used marijuana in the last 30 days, but in fact, only about 14% had. So how do we help educate our students about dangers while syncing their perception with reality? The one thing that I want to talk about that I think has been really a game changer for us has been the triage model that the consultation and counseling service is using to support students. And this is really an opportunity for students to get a touch very early in their concern. So a student will call in, say, I want to make an appointment with a counselor, and they will be asked to give some information, give their naming the best number to contact them, and then a counselor will call them within 72 hours and have a conversation with them via phone. The first fall semester after the triage model was implemented, we saw a 43% increase in clinical interactions with students. What this allowed is for our counseling center to cast a wider net to ensure that students who are most in need of assistance are recognized. So the triage system really operates by offering and providing students a screening with a therapist, and then it allows that therapist to help the student think about what next steps. Do I need individual? Do I need group? Do I need to see somebody immediately? Is this an urgent issue? I talked a little bit at the beginning about the culture of wellness, and I said at OSU, our foundation is wellness. We have 9 dimensions of wellness, and I'll just run through them very quickly: emotional wellness, career wellness, social wellness, spiritual wellness, physical wellness, financial wellness, intellectual wellness, creative wellness, and environmental wellness. But what we really do, the work that we really do, is that we ensure our students have the opportunity to work on and to develop their wellness from the place that they are to the place that they want to go. So everything from wellness ambassadors, who are students who have 3 hours per week that they are engaged in wellness activities that are outreach activities, like our weekly wellness hut. That's a pop-up tent that pops up all over campus and has different issues that they're looking at. So as students just come by on the quad or other place, on the oval or other places that they may go, they are able to have that touch, that outreach. We have our wellness coaches, which are individual students and professionals who are improving mental health through empowering students to use strategies to accomplish what their goals are. And we make sure that we have multiculturally comprehensive services. So at our counseling and consultation service, we have services in 7 languages: Spanish, Mandarin, Cantonese, Korean, Hindi, Turkish, and English. Now, if you were on one of the coasts, that wouldn't be that different. But for a Midwest institution, that's pretty amazing. For 2 years, we've gone to China to conduct pre-departure orientations, where we also talk about mental health with the parents, which is something we had never done before. Those pre-departure orientations have allowed us to do things differently. As with all of us, we have a consultation and assessment team, usually called a CAT team, sometimes other names for that. But that is the opportunity for institutions to connect connect services across the campus. We have student life, administration, counseling, consultation services, student conduct, advocacy, the OSU Police Department, the Disability Services, legal, and often our faculty peers. Before coming to, we have the Let's Talk program, and I should give a nod to Cornell. Thank you very much. We actually utilize that from the work that you've done, and you were gracious to allow us to use that. And right now, we're 2 hours in the Office of International Affairs to really outreach and be where our students are. We also have a satellite office, which is connected to our one of our recreational sports facilities, where we have counselors and therapists available there. We also just recently, our professional deans, our deans of the professional schools, were very concerned about their students, and we connected and collaborated so that they will help fund therapists who we can hire, who can be traveling therapists in the professional schools. We're looking at how we can outreach to our community to make sure that the health and wellness of our students, so that the stress is lowered and that our students are supported. But when I asked my director of the Counseling and Consultation Services, Dr. Mickey Sharma, what he thinks the most significant thing that administrators can do to support student mental health, his answer might surprise you. What he said is that while he certainly would never turn down more therapists, the most meaningful thing that can happen is that administrators show support for communicating and prompting and promoting the support of students' mental health, because it's everyone's responsibility. I live on a campus where I have been very fortunate, and our new president, Dr. Michael Drake, is really a proponent of student life and student affairs, and most importantly, the health of students. He has been just an advocate for the things that we do and the ways that we change lives. And he has really given us the commitment to increasing the resources, because, you know, we talk about commitment, and commitment without cash is kind of counterfeit. So having that level of commitment changes what we can do and how we can be successful. But we need everybody engaged in it. We need our faculty, we need our staff, we need our students, we need our community to say that what is most important is how our students develop, how they are well when they leave the institution, and how their experience of their wellness and their health has helped them prepare for the walls outside of the university. What we ask from everyone in our community is that they respond. The fact that we're here together today having this conversation is important, because that is what we're doing. We are responding to our students. Thank you so very much, and I look forward to the rest of our dialogue.
All right, we have, I think, about 10, 15 minutes for questions. So please come up to either of the microphones if you have a question. Please go ahead.
Good morning. Thank you for your presentations. So I work here at U of M at the School of Social Work. We have master's level students. We're seeing a lot of the issues that you're talking about today. It's particularly important for our students because they're going out and helping others who are having pretty challenging situations. I'm just wondering, you all talked about such great interventions. How do you package that for your students as they're coming in and really get buy-in at a time when they're really overwhelmed with a lot of information coming at them?
I'll just start by doing two things. One is trying to be very simple when they're first coming in and not falling into the trap of giving everybody what they want them to know over the 4 years. Because they're just trying to figure out where the bathroom is and how am I going to make a new friend, which is really where their priorities are. So we make sure that our staff who are interacting with our new students are well trained to be a resource, and we have stickers in the back of every single bathroom stall all over the campus about numbers to call if there's a problem, so they get a subtle but easily accessible. And then we do some screening for the students who, as they're coming in through their health history forms, are those who we believe need to make connections right from the beginning. But part of it is just having it in the culture of this is a resource that we provide along with everything else.
One thing I will add that we moved to after our own Enhancing Campus Culture conversations is looking to upper class students and utilizing them in narratives as a part of undergraduate orientation as students launch at the university. We do a program called Community Collage, where students look at their own experiences who've been with the university for a couple of years or more and share with their incoming class what they've learned throughout their tenure. And we find that that connection to older peers who've been through the experience has been really powerful for us.
I would say one of the things that I love about being at a university is students and bright ideas. And so students bring us different ideas each year. And very similarly, we look at students and peer intervention as probably our #1 resource. It's interesting because a group of students came to me, I guess it was last week, and they want to put a sticker on the back of our Buck ID card. And they want it to say, here are the numbers to call when you need help immediately.
Yeah, we just went to that, actually.
Great. Sir? Yeah.
Hi, thank you. This has been a really thought-provoking presentation. I heard a little bit about the kind of population of students that you see at your schools. Vice President Adams-Gaston said that students come in with a row of merit badges that is a mile long but an inch deep. Vice President Murphy said that you find that your students haven't had a chance to fail and learn how to do that. I just wanted to bring into the room another set of students. I am from the City University of New York, and I see students there who have maybe failed too much, or maybe more accurately have been failed too much by the systems of education and support in the city. And that continues to happen at CUNY. And I think that can be tied to something that Vice President Adams-Gaston said, which is that commitment without cash is counterfeit. I just wanted to draw people's attention to this room, which is a beautiful room, and which I think quieted everyone down, and we really were able to listen to you. Where I teach, there are mice running through the lecture hall. Students complain about it, and what their teachers have to tell them is that they shouldn't bring food into the lecture hall. So I was hoping that we might be able to talk a little bit about beyond the environmental changes, which are clearly so important, and what people on campus can do. I'm curious to know how you interact with your donors and your state supervision, for those of you at a public institution, to really convince them that the money to invest in spaces, in the opportunity to slow down is key. I think that at the institutional and financial level, we're as caught up in this culture of speed and efficiency as our students are.
I could do that too, yeah. So a couple of things. I think that you touched on some issues that are very real. We see some issues around first-generation students, for example. And Dr. Terrell Strayhorn has done a lot of work on grit, and grit being positively related to college grades for particularly black males, and that in conjunction with their background traits, their academic factors, but grit explaining 24% of the variance in black males' college grades. So how do we help people harness that grit and be able to use it, because they may have had a lot of difficult things that have happened to them. So how do we help them harness that and use it to be successful and to be well? Because they still need to be well. But on the issue of donors and money and other things, and let me give credit where credit is due. I wish I had made up commitment without cash is counterfeit, but it was actually Dr. Frank Hale at OSU for whom the Black Cultural Center is named. Couple of things. We are charged with doing more around donor and donor support. In fact, while I was here, I had a donor who just gave significant money to our student advocacy program because they are concerned about students who have things that happen to them and need support. So I am, as we all are, always working with our donors. and Susan just sort of whispered, state support. State support has gone down significantly across the nation, and I don't see that coming back anytime soon. So how are we going to look at the university differentially with the resources that we have without, outsourcing everything that we have in our portfolios, and have a situation where we're able to not have the mice running across the floor when the students are in their classes? We're going to have to be more creative, and we're going to have to be more aligned. And one of the things that I say is that in this time when students are coming, when students have choice, so they can be online and do their entire education online, or they can come to campuses. We have to provide something in the campus arena. And I think we do that when we connect our student affairs and our academic affairs, and we say that it is the interaction that gives students something different. But we're all gonna be called on to look at our resources in a different way, and to make sort of ends meet by donor support.
Okay, well, so I'm going to try something a little unconventional here. We have just a few minutes left. What I'm going to ask, and we have a lot of questions, so if you could each quickly state your question or comment, and the panelists will just kind of take note, and then we'll go 5 minutes over, and then maybe just pick one of the questions or comments where you feel like you have the most scintillating thing to say about it.
Hi, I'm Dr. Winfield from University of Michigan, Chief Health Officer. Particularly for Dr. Murphy and Dr. Casalegno, you both have described motivating the faculty and leadership, but both have come out of external crises of suicide. Do you have any advice about how to motivate and engage faculty in this productive way without a crisis?
Great question. And over here.
Hi, so I'm a senior public health student and a wellness ambassador at The Ohio State University. I specialize in stress management presentations for first-year students. And I kind of have come across this problem that students, it's not really that they lack resiliency, but rather that they are taught and grown up to believe that failure is not an option. And going forward, I can't really help them manage their stress if their stress is coming from something that they were raised to believe. So I kind of just wanted to pick your brains and hear your thoughts on how to advise these students to accept failure and go forward from there.
Yeah, thank you.
Hello, my name is Courtney Klaus. I'm a graduate student at Central Michigan University. I'm currently interning at the Counseling Center on campus, and we have approximately 20,000 students on campus and only 14 counselors. We're desperately in need of more counseling services, and I'm trying to advocate for that with our administrative staff. I guess my question for you is, what was key to some of those beginning conversations and helping the administrative staff understand how important those services are to students?
Thank you.
Hi, I'm Denise Kozakowski, an academic advisor here. My comment relates more to me being a parent of a graduating senior and then a junior right behind. We looked at a number of schools in the Resilience Consortium, got tours of the campuses. Not one of the tours showed us the CAP Center, talked about what's available on campus. Not one of the tours talked about how to deal with failure. I'm wondering if there might be a way to introduce that as you're selling the school.
All right, thank you. And last comment or question.
Hi, good morning. My name is Ray. I graduated from Ohio State. I'm interning right now with the Suicide Prevention Program. I'm a peer-to-peer suicide prevention trainer, and I'm from China. So my question is, for all three of you, what are the things that you have done for international students regarding mental health? I know, Dr. J, you already talked about the pre-orientation departure and everything. I was actually a coordinator for that. Very much appreciated. So I really want to hear from all the other panelists about that. Thank you.
Great, thank you. So we have, now each of you in 60 seconds can answer all 5 or 6 questions. And
one
All right,
each.
I'll tackle one that resonated for me in asking the question about how do you motivate the conversation absent crisis on your campus. I think there are great examples that were offered here in looking to data and statistics, and this actually points to how do you argue for resources. We were able to argue for resources not just because of the campus conversation that we were having following Henry's loss, but we were able to show the trends, we were able to show the usage in our center, we were able to show nationally what was happening and what was forecasted, and made a really compelling sell. So our director of counseling, Kurt Kumler, and I took that forward and got the resources, not all the resources we might need to the conversation that we've had. But I think that's really powerful. And to the question about how you get people to care, how do you get faculty to care about these issues, I think you can turn to your faculty about what their experiences are. They are living this in seeing this in the classroom every day. And the data from the NCHA, the National College Health Assessment, the Gallup poll, there are all sorts of data points that you can use to help make the case.
And I'll just add, one of the things that I think has been very useful is conversation with faculty and administrators, deans and others, because I do think they're seeing these same things. They want to help. At OSU, in our second year program, when we go into our requirement for students to live in second year, we built that program based on the information we knew about factors that enhance the second year success, one of which was interaction with faculty. So in their second year, all second year students who will live on campus starting fall 2016 will have the opportunity to work with a faculty member. There'll be 20 students to each faculty member, and those faculty members will be 5 housed together, not physically, but coming to the residence halls to work with the students in that second year. Because what we saw was we have lots of support for students in the first year, but that second year is really a gap year in some ways, and so we're trying to look at that. But what I will say to you is the data matter to the faculty, to the administrators, and their experiences matter. And being able to be in conversation about that really reshapes what is most important, because everybody is struggling with resources.
I want to just build on that, and then I'll address the international. We found if we could get the door open with a faculty department meeting, inviting ourselves to have a session, a professional development session, the faculty would promise us 20 minutes and we would be there over an hour. Because almost always the faculty knew someone who was having a trouble, it was dealing with it in their own family, and this was giving permission for that conversation. And to the point made earlier, they are seeing the behavior in the classroom. And so part of what we were trying to say is we have a professional expertise that can help you. If these students aren't getting help, they're causing disruption or difficulty in your classroom. So we do take the belief that let no good crisis go unused, and we definitely did that in this area. The other thing I would just say to the data, which are absolutely critical, I believe we also have to show that we are willing to think about new strategies, that the very traditional model of a 50-minute session, packed into the 8 to 5 time frame, if that's what you're going forward as the only solution, I won't even get a hearing. So all of the other ways that we can find to support our students, and then we also do need the human-to-human connection is critical. Lastly, and there are other very good points, I'm sorry we can't get to them, on the international students, many of us, I'm sure it happens here, we run a week-long program for our international students before orientation begins. Some of that's just to get their biological clock on time so that they can participate in the program, but they're introducing them to the resources that we have on campus. We have our Let's Talk in the international student and scholar offices as well as within the international residence. And increasingly, although I think we have way more work to do here, diversifying our staff and trying to figure out how to partner with a growing number of student organizations around the international cultures and using them as partners.
And the final thing that I'd like to say on the students being afraid to fail and that sort of being a part of what they bring with them is we have an opportunity. The programs that students come up with, like Are You OK, and other programs that allow students to talk about not doing as well as they had anticipated. Giving that space and peer-to-peer ways to do that, highly successful.
Well, let's express our gratitude, not just for these wonderful presentations, but also for their incredible contributions to student success and well-being over the years and continuing on. Thank you.
Thank all of you. Thank you. Thank you.